What's up YouTube, I'm Mike. Today I'm going to shoot a quick video. It's a follow-up video to my TRT video where I'm going to actually show you how I do my injections. I don't know if YouTube is actually letting me show the pinning, but I'm going to try anyway. So just to cover all our bases, this is my legal testosterone replacement therapy from Hollandale Pharmacy on the vial. Can you get that? Okay. Testosterone cypionate 200 milligrams per milliliter in grapeseed oil. So like I said, this comes from Hollandale Pharmacy in America. This is part of my TRT protocol. Then I have my HCG that I'm back on here. And we've got a couple of insulin pens and my drawing syringe. So I'm prescribed 200 milligrams per week. I break that into two 100 milligram doses on Saturday, today, and on Tuesday. So I'm going to show you how I do that. Now, it takes a little while to pull this down into the insulin pen. These are easy touch 29 gauge half-inch insulin pens. So it takes a little while to draw that down. So I'm going to draw up my shot and then we'll come back and I'll show you two different places that I pin it. Exposed. So alcohol wipe. I'm pretty lean right now, so I don't have a whole lot of fat to pin, but I'm going to grab this spot right here, swab it with the alcohol. And unfortunately, I don't have any short pins. I don't know what happened. I didn't calculate properly. So today I'm having to use the half-inch pin, so I'm gonna be careful, only go in a little bit. Probably really doesn't matter. But you just take the skin, pull it back, stick the pin in, and then push that right underneath the skin. That's how the HCG goes in. After you put it in, because it's subcutaneous, you'll feel a little lump right underneath your skin, but it goes away pretty quickly. So 500 units of HCG twice a week. And then this is the half-inch pin with my TRT shot in it. What you're supposed to do in the TRT protocol is, as I've said in the other video, stick that pin in your butt. And while you can do it without problems, if you hit something back there, my wife usually does these shots for me, and you're gonna see why in a minute. But if you hit a nerve back there, that shit really hurts. It's just generally not comfortable, it's not fun to do. So that's why I'm making this video, to show you a much better way. So what I do is a rotation. I hit my delt, my pec, and then my delt, just to spread it around every week. So I'm going to show you two of those today. Typically my wife does this, and as you'll see, I have a very shaky hand, so I end up tearing up I end up causing it to bleed, and I don't want to lose any of the oil, so generally she does that, but we're going to see if I can do it today without too much problem. So swab your shoulder. I like to put it right on like the crown of my shoulder. Seems to be the best. So I'm going to put half of this right here, right now, and then I'll hit my chest. So you just go straight into the shoulder. As you can see, my hand shakes horribly. The oil is very thick, so it takes a second to go out. To go in, that shaking is not ideal. And then come out. And hopefully you get no blood, which I didn't. So that's one thing you can do, is put half a mil or a mil, it doesn't matter, in your shoulder like that. The second place is in my pec. The guy from Viking Alternative Meds went over this. I can't remember if he shows or not, but I swab right here, just off the sternum a little bit. This is actually much easier to do when you're doing it yourself. Go right in next to the sternum, and then just push the oil. I push it relatively slowly. I don't know if it really matters, but I'm not really in a hurry, so. Push the oil. Smash the plunger a couple times, just try to get everything that you can out of the pin, and then right out. And that's it. These injections are really totally painless. Sometimes when I hit my shoulder, my muscle will twitch, and that's not a comfortable feeling, but it doesn't hurt. It's just kind of bizarre. I usually have no problem at all hitting my pecs. One of the things that you may notice if you try these routes, and I think this is true of any, any injection that your body's not used to, the first week or so, you may notice a little residual pain after the injection. I know the first time I started hitting my chest, I was laying, like a day or so later, I was laying on the leg curl machine, and when the machine pressed on my chest, it kind of hurt. There was some residual soreness. But once the body gets used to the fact that you're putting something there, I never have soreness at this point. So I would do delt, pec, pec, delt, and then repeat. And that's how I do it. So hopefully you got something out of this. Hopefully this was informative. If you're on TRT, if you're cycling. One other thing I'll mention before I go, if I was going to cycle, which of course I don't because it's illegal, but if I was going to and I was going to be pinning a larger dose, I do that right here. Actually, my wife does that right here on my lat. So you can go back and forth on each side. There's some veins there, so I usually kind of flex a little bit and try to get the blood flowing so that she can see where the veins are. And these spots here with larger doses, like a milliliter or more, are absolutely the best part on your entire body to pin. They are totally painless, next to no residual soreness. It's kind of weird the first time when you feel the needle go in, but really honestly, of all the locations of my body, I prefer my lats the most, and so when she's doing it, that's usually where we go. So again, hopefully this was informative, hopefully you got something out of it, and we'll see you on the next one.